I just want to ask you some questions because I know in your experience, you are working with a lot of men who have been through a radical prostatectomy, radiation therapy for prostate cancer. And I love your approach, a very holistic, a very not only psychological, but physiological approach to across all realms. But in our case, what we're focusing is on those patients who've gone through a radical prostatectomy. So, if I may ask, the first question is when you say a holistic approach, tell me what you mean by that.
So when we say holistic approach, really mean taking the person-centered approach, understanding that the person is more than just their physical body parts, but certainly encompassing the psychological, the social, the cultural, and the interpersonal aspects of their experience as a person living in their body and also living in the world around them. So all of those factors, as far as the human experience, are really important when it comes to anything that shapes or shifts our well-being and the way that we engage with the world.
And it's not a simple thing. It is so complex. And so when you say the ripple effect, that was another thing I saw you mention in another conversation that you had with a doctor. As I understand that, that is treatment for erectile dysfunction. Doesn't just cover erectile dysfunction, but it may also cover incontinence, bowel, urinary incontinence. Can you talk about what you mean when you say the ripple effect?
So if we're speaking specifically to a prostate cancer treatment and the consequences or sequelae of that particular treatment, we have to consider that there are several things that are going to be different for that person and how they're experiencing their body functions. Not only just their physical body functions, but also the emotional and one sense of self and identity related to what our genitals and function of our genitals mean for us. And that definitely does change as a consequence of the sequelae related to, for example, prostate cancer treatment. When we're talking about a prostatectomy, for example, and I have a model here that may be helpful to use in this example for folks in case we're not familiar with some of the anatomy. Just a brief 101 here. Everything in between our butt bones is called the pelvic floor, the perineum, and that encompasses the muscles, the nerves, the blood vessels, the veins, the lymphatic structures, the genitals, etc. If we were to look inside of the pelvis, you are going to see a bladder, a rectum that lives behind there. If I were to open the pelvis, for example, if we were to cut you in half and look inside like a book, what we're going to see here is the front, bladder, prostate, and rectum, and then the accompanying pelvic floor musculature that live here. During any prostate cancer treatment that may impact the neurovascular structures that support erectile function, for example, like the cavernosal nerves to the penis, which is often compromised in pelvic cancer treatment in general, whether it's radiation or whether it's actual removal of the prostate gland, resulting in immediate neurovascular injury or damage. The individual is going to incur or experience sexual dysfunction. So that is definitely a number one thing. The second thing is also urinary incontinence, because when we're talking about the anatomy here, at the top of the prostate gland is a sphincter called the internal urethral sphincter. Now, looking inside the structures, that sphincter lives up here. When the prostate gland is removed, that internal urethral sphincter also is removed, in addition to the other accompanying structures like the seminal vesicles around the prostate. That removes a primary continence mechanism, which means that the reliance is going to be on the pelvic floor musculature and the external urethral sphincter, which is located or at the apex or the bottom of the prostate. So urinary incontinence is going to be a big deal for a lot of people, including men, right? So the first thing that guys want to take care of is the leakage problem, because having urinary incontinence not just impacts your pants and what's going on physically with wetness. But then it ripples into all aspects of your life: self-confidence, self-esteem, your motivation and desire to want to engage socially. You're constantly looking for a bathroom. Maybe it becomes burdensome because you have to carry continence care products with you. I mean, there's so many things involved when we're having difficulty with bladder control. And the last thing on your mind with that is also sexy time, right?
Yes.
You're not
Yeah.
going to want to feel, want to engage sexually when you're just feeling so not confident in your body's ability to control bladder function. And one thing I will also note is that when bladder leakage occurs in some men who've had prostate cancer treatment, in particular prostatectomy, something called climacturia, or leaking upon climax or during climax, might actually be a thing. And we really don't know what predisposes one individual to experiencing climacturia versus another, but we do know that it is a occurrence that may happen as a result of a prostatectomy, for example.
Yeah.
And so it's important to have these conversations. It's important to have these conversations around, this isn't a permanent thing for the rest of your life, that there are things that we can do to support your rehab recovery, to educate around certain sexual resources or continence control mechanisms. For example, I'm sure many people, maybe they have, maybe they haven't, but using a pump actually has some preliminary research around continence recovery outcomes, that it may help with that. Doctors are not talking to their patients about what happens afterwards. What do we do
Yeah.
afterwards when I'm faced with all of these physical and emotional challenges that are happening in my body? Who do I go and talk to?
Yeah.
How do I even use a pump? That you won't believe how many men come into my office saying, like, I really do. I was told to use a pump. I have no idea how to use it.
Yeah. If you would like to check out Dr. Gronski's YouTube channel, I'm going to put a link to that right here. And if you would like to go to drsusieg.com, I will link to that website in the description of this video. But we plan on doing more interviews like this, trying to gather as much information, get it out for those of you who are struggling with erectile dysfunction, whether you are post-radical prostatectomy patients, whether you are patients dealing with organic erectile dysfunction, whatever it is, we want to provide as much information as we can and support you any way we can. If you have questions or recommendations for other videos you'd like to see, you can write to us at education@timmedical.com.